and welcome to ASEAN Health Meet. We are all here together to discuss about required reforms for our country. We have Jatan from Thailand, we have Rebecca from Cambodia, Samira from Vietnam, and we have also a special guest from WHO who is going to explain the required reforms of our country. So I welcome Pamrinda Kaur from the WHO.
Thanks a lot,
Thank
Dr.
you.
Sonal Shanagat, for the introduction. So, hi everyone. So today we're gonna discuss about the report by WHO on the comparison of 5 countries in terms of healthcare system. So we choose Southeast Asia group. Although Southeast Asia group contains 10 countries, but we have chosen 5 countries who are not doing that much good. So we are just making a report of that. The countries are Thailand, Vietnam, Cambodia, Laos and Myanmar. So what we're going to do is compare them on the basis of WHO framework, on the basis of financing, service delivery system, workforce, technology, governance and information system. And then we'll compare them on the basis of what is similar in their healthcare system and what's the difference that is creating some issues and challenges, and what the government is doing and what the non-governmental organizations are doing. Thank you. So let's begin with the PowerPoint presentation. So first of all, why we are gonna compare all these countries together? So to assess the healthcare system of one country to improve the conditions of the system in other country, we are gonna assess those systems. As we all know, Southeast Asia group belongs to 10 independent countries like Singapore, Brunei, Cambodia, Indonesia, Malaysia, Philippines, etc. But we're gonna focus on only 5 countries, as the countries are changing their system day by day because of the increasing population, economic growth is there, and also these countries, as are belonging collectively, they are known as Association of Southeast Asian Nations. On the basis of demography, we can compare these 5 countries which are having the highest population on the basis of area, population, life expectancy and total expenditure. On the basis of population, Vietnam has the highest population out of all the 5 countries and Laos has the lowest population. Mainly we have to focus on the health expenditure. As you can all see, there is also life expectancy, but we have to focus on the health expenditure. The highest health expenditure by the government is for Vietnam, that is 7.1%, and Myanmar is spending only 2.3% of the gross domestic production on healthcare systems. These are the various emerging issues and challenges in relation to culture, demography and geography. As these countries mostly belongs to the disaster-prone areas like natural disasters, tsunami, Nargis. So there is a risk of infectious diseases like tuberculosis, waterborne diseases. That's a very major issue. And also there are rural areas which do not have access to the services of healthcare. The people are preferring traditional medicines as compared to the modern medicines. And also chronic diseases are a major priority nowadays, like type 2 diabetes mellitus, because the lifestyle of people are changing and the sedentary lifestyle is the most, as you can say, is the most chronic cause of that. These are the various challenges and opportunities in terms of health system. Like the challenges include the dual practice, high changing the system, demographic changes, and lack of technology and recording system. But however, there are also some opportunities. If we want to improve the health system of these countries, we have to focus on these opportunities. Like if we focus more on the technology. Nowadays, young people are using more of their mobile phones and internet services to access for healthcare needs. And also urbanization, then private spending for the quality ones, and the potential for increasing the growth rate is also on the pace to increase the healthcare services. These are the various issues in healthcare systems in terms of WHO framework. That is, there is lack of medical facilities, especially in rural areas. They have very less number of doctors, hospitals, and other basic services. Like there is no institutional delivery services in Laos and Myanmar, and there is also lack of funding from the government as well as non-government organizations in terms of healthcare delivery systems. There is a problem which includes the dual practice. Like the private practitioners are doing the dual practice, they are doing the government work also and their private work also to increase their salaries. And the out of pocket expenditures in Cambodia and Myanmar is a major issues. This is a very good graph that explains typically the comparison of healthcare expenditure in terms of GDP, including both private as well as public sector. As we all can see, Vietnam is expending more on the healthcare services, and the lowest expenditure in terms of GDP is by Myanmar, that is only 2.3%. This is a very good picture of comparison of all of the five countries worldwide also, and we have compared them within them five regions also. So worldwide, WHO has given Thailand 47th rank and Vietnam 160, followed by Laos 165, Cambodia 174, and Myanmar scores the last rank, that is 190. And in comparison both in all the countries, we have seen that Thailand has good standard of healthcare and focus. They are mainly focusing on the quality of services, followed by Vietnam, which have just the basic healthcare facilities. But in Laos, Cambodia, and Myanmar, there are poor level of healthcare systems. So this slide is just a similarities and differences comparison profile, which compare all the five countries on the basis of WHO framework in terms of service delivery, governance, technology, workforce, and health infrastructure. So in terms of service delivery, Thailand and Vietnam are doing good, but other countries are lagging behind. The lowest government expenditure is spent by Myanmar. In terms of health information system, Thailand is very good. So we have ranked according to the average and good doing countries in terms of stars. Initiatives in healthcare system. So all the governments of the countries and the NGOs are doing some important improvements to improve the healthcare system, such as the 30 Bahat schemes in Thailand, health and equity funds in Cambodia, then the health fund for the poor in Vietnam. Other NGOs are also working to improve the conditions, like we are doing, World Health Organization is doing, UNICEF. Then there is also some local governmental and non-governmental organizations. So these are the basic recommendations that are put forward by us to improve the conditions, that to improve the conditions of healthcare system, the basic needs, to increase the access, increase the funding, and to follow the millennium goals, and to decrease the social determinants of health. This is a basic model for given for future reforming in health system by Geolite. So if we have to follow this model, a clear vision should be of the objective, what the government have to do, what the government will do to increase the access of the services, how they want to invest in the financial system, what are they doing, and what the people's needs are. All the private plans and services and strategies should be made in accordance with the people's need. This is a simple action plan, a strategy plan, a cyclic process that every country should adopt according to WHO to improve their national health plan. Every plan should be made in taking in mind the objectives, then the financial assistance, proper implementation of it, and monitoring and evaluation will lead to the success of a very good plan. So these are some of the references from where we have taken our data from. So according to all the delegates, what you guys want to recommend for the government of your respective countries to improve the condition of healthcare systems?
Um, I'm representing Lao. So as you have mentioned that their government expenditure is 2.8, which in 1995 was 4. So we can see there was a drastic fall of the government expenditure. According to me, Lao government should take some relevant reforms, not in particularly increasing the funding, but where they have to put their funds, especially in training staff, because we do not have much trained staff, and also to increase the technology, because in Laos there are only 7 CT scan all over the country, so our radiology department is not doing very good. These are the two things that I want Lao to do good.
Oh, that's a very good opinion. So we're gonna
Thank
put
you.
that forward in our report. So we would like to hear from the representative of Cambodia also what they want to recommend to improve the conditions.
Yeah, I would recommend that we build and train more staffs because workforce is relatively low in the country, and also we should balance the deployment of trained staff with both rural areas and unbound areas because there are more trained staffs in unbound areas. Thank you.
That's a very good recommendation. So according to the delegate of Thailand, what's the main issues and recommendations you're gonna put forward for?
Normally, the Southeast Asia are prone disasters countries, and normally there are infectious disease involved, and it is mostly epidemic like malaria, typhoid, influenza, HIV, and other diseases. But they have a lack of FDA approved vaccinations. Recently, they just found out the first case of the Bartonella disease and Q fever endocarditis. And still, after that, some more cases was there, but still there is a no policy, no strategy for this kind of disease. So they should make some more strategy on the vaccinations for these particular regions because so many diseases are over there.
So that was all regarding our presentation. So we will put forward these recommendations to the respective governments of your countries and will prepare a statistical report according to that. So thank you all you guys.
Thank you.
Thank you so much.
Thank you everyone for your valuable presence.